CTE Pathway Updates, Summer 2026. I'm Melissa Leeds, CTE Education Consultant. For school year 26-27, Healthcare Professional Pathway Updates. HH32, Pharmacy Technician, the status for school year 26-27, the course is in standard. The proof of learning is the credential. The credential is the Certified Pharmacy Technician, which is the proof of learning. Professional development sessions will be held at summer conference. And some notes, the North Carolina Board of Nursing, the NCBOP is proposing updates to expand the role of pharmacy technicians in healthcare facility pharmacies, including allowing specialty trained validating technicians to perform additional medication verification, automated dispensing, and compounding related tasks under a pharmacist's oversight. The proposed changes would also broaden eligibility for these roles through the National PTCB certification and extend the rule beyond hospitals to all qualifying healthcare facilities. There is no cost increase for either exam, that being the PTCB or the EXCPT. I just wanted to make you aware that if a student wants to work in a hospital, the PTCB exam would be the better choice for that student. However, students can still take either exam. HN43, Nursing Fundamentals and Practicum. The status for school year 26-27 is standard. The proof of learning is the credential. The credential is the North Carolina Nurse Aide 1. Professional development sessions will be held at summer conference. Beginning January 1st of 2027, the cost of the North Carolina Nurse Aide 1 exam is increasing from $140 to $145. North Carolina Division of Health Service Regulation, NCDHSR, and Credentia have been made aware of difficulties many PSUs are experiencing with computer-based testing. NCDPI has made both partners aware that there is legislation in North Carolina that prohibits our students from screen sharing while using a school-owned computer or while using school Wi-Fi. Many PSUs with Nurse Aide are using ExamLock Lite while their students take the written or computer-based exam. If what you are doing currently is working, then continue with your practice. However, if your PSU is struggling with students taking the written or computer-based exam, your PSU can apply via the Credential website to be a group testing site and use ExamLock, which is the enhanced version of ExamLock Lite. Please be aware that applying to be a computer-based group testing site can take time for approval. It is recommended that you make application to Credentia prior to the start of the school year. ExamLock allows screen monitoring in the background versus a live proctor. Credentia will be offering training sessions for those PSUs that want to utilize the group computer-based testing option. This training will be posted on the Nurse Aide and Endorsement Courses Canvas. You will need to make your application to Credentia at credentia.com, Test Centers, INF, or in facility. In addition to the addition of computer-based testing will cost an additional $4 per student. This must be requested when you order your voucher codes. If you currently have extra voucher codes and want to utilize ExamLock, you will need to order this as a separate voucher. If you have yet to order your vouchers, you can add ExamLock into the order for school year 26-27. Of note, being an in-facility computer-based testing site is distinctly separate from being an in-facility skills site. Credentia currently manages Nurse Aide testing in 21 states. Your vouchers should be ordered early. Typical voucher turnaround can take up to 30 days during non-peak times and over 45 days during peak times. Consider creating an email that is generic and attached to the school nurse aide Credentia platform account. This generic email address can be attached to CNA 365, which is the Credentia platform, to ensure if a teacher retires or leaves that someone has access to voucher codes. When ordering vouchers, please ensure you order split vouchers, that being one for skills and one for written. In coordination with NCDHSR and Credentia, NCDPI has created a new nurse aide application process. The nurse aide application, as required by NCDHSR, will no longer be available on Moodle or Canvas. Teachers attending summer conference will be provided the applications. Teachers who do not attend summer conference will have opportunity through scheduled professional development to discuss the application process, and then they will gain access to the application. All nurse aide teachers will learn about the role of the local program coordinator as well as the role of the statewide program coordinator housed at NCDPI. This decision was made in coordination with our partners due to over 68% errors in the nurse aide applications that require technical corrections for processing. Once the application is received at NCDPI, validated as correct, a DocuSign will be sent requiring signature of RN teachers, program coordinators, school level principals, and CTE directors. All nurse aide labs must be approved prior to teaching nurse aide. If you are moving a nurse aide lab to a new school or opening a new program, please contact Melissa Leeds at melissa.leeds@dpi.nc.gov for approval of the lab. This will be accomplished with a site visit to the nurse aide labs. If you have questions, please let me know so that I can assist. All students should start out in HN 43 Nursing Fundamentals and Practicum. Students who are unable to complete the clinical skill requirement can be moved from HN 43 to HN 42 Nursing Fundamentals and Non-Practicum. Moving forward for school year 26-27, any student moving from HN 43 to HN 42, documentation will be required that will be signed by the RN teacher, principal, and CTE director. RN teachers are also required to notify in writing NCDPI prior to the movement of a student from HN 43 to HN 42. This notification should detail the why the student needs to be moved between the two courses. This documentation should also be sent to Melissa Leeds. Documentation for moving a student from HN 43 to HN 42 can be found on the Nurse Aide and Endorsement Courses Canvas, specifically under HN 42. Nurse aide documents are auditable by NCDHSR. Documents must be kept for 3 years. In the event a teacher moves schools, retires, the document should remain with the school. Every student who is eligible to credential should have a nurse aide training summary document and a notarized certificate of completion signed by the RN teacher in their file. The certificate of completion for a student is good for 2 years. The original certificate of completion should be given to the student with a copy held in the student's file. A list of auditable documents can be found in the Nurse Aide and Endorsement Courses Canvas, specifically under HN 43. Nurse aide instructors are authorized to allow students to test 3 attempts for the Nurse Aide 1 exam, being written 3 attempts and skills 3 attempts. If a student does not pass and get their North Carolina Nurse Aide 1 credential after 3 attempts, the student will need to take a remediation course from either a private company or the community college. The Memorandum of Understanding between NCDPI and NCDHSR does not allow for our programs to remediate students. Authorization of a 4th nurse aide exam by a high school RN instructor is a reportable offense to the North Carolina Board of Nursing. If a teacher retires, quits, or moves schools, all nurse aide documentation must be secured at the school. The documentation does not move with the teacher. All RN teachers teaching nursing fundamentals must have access to the CTE Resource Center on Canvas. In the event of issues with Credentia, being ordering vouchers, skills exams, etc., a Google form is in the process of being created to report such issues. This Google form will be placed on the Nurse Aide and Endorsement Courses Canvas for your use. Pathway Professional Development Opportunities for School Year 26-27. School Year 26-27, Healthcare Professional Pathway Professional Development. Monthly webinars from the Health Science Educators Association are held virtually on Zoom. These opportunities will be posted on the CTE Resource Center. The National Consortium for Health Science Educators Annual Conference will be held in Birmingham, Alabama in October. The NCACT Health Science Division Education Fall Workshop will be held in November in Morehead City. And other professional development topics are listed on the screen, and they will be held virtually. These will all be posted on the CTE Resource Center. Consultant office hours will also be held on the second Tuesday of the month from 7 in the morning until 8, and the fourth Tuesday of the month from 3 until 4. Teams links for office hours will be posted in the CTE Resource Center. School Year 27-28 Healthcare Professional Updates. Please note that updates for School Year 27-28 are tentative and may change. For School Year 27-28, a new pathway, pre-nursing. The prerequisite course options could be any of the following: HU44, Medical Anatomy and Physiology, which was formerly HU40, Health Science 1. HU40, Health Science 1, will be recognized until school year 31-32, or HP71, Project Lead the Way Human Body Systems. The concentrator course options will be any of the following: HN43, Nursing Fundamentals and Practicum. All students, again, must be enrolled in HN43. HN42 is only utilized when a student cannot meet the requirements for HN43. CTSO updates, HOSA specifically. HOSA membership as of June the 23rd is 11,816. HOSA has realigned the regions. The region split will be effective July the 1st. If you or your HOSA advisor have questions, please reach out to Executive Director Jennifer Epperson. Leadership Conference opportunities. Regional leadership conferences are held in November. State leadership is held March 17th through the 19th of 2027 in Greensboro. And the International Leadership Conference will be held in Philadelphia, PA, June the 22nd through the 25th of 2027. Information will be sent to HOSA advisors as soon as it becomes available. School year 26-27 hosts of fees. Of note, there is an increase in price for international leadership registration from $145 to $150. School year 26-27 public service and safety pathway updates. We are making a change and removing the requirement for Public Safety Academy approvals starting school year 26-27. Our statewide partners do not require this step, and therefore NCDPI, in conjunction with our statewide partners, have decided to eliminate this step. However, it is imperative upon PSUs to ensure their instructors meet the requirements to teach the course content. 21 Emergency Medical Technology 1 and IP22 Emergency Medical Technology 2. The status is standard. The proof of learning is the credential. For IP21, the proof of learning is the Emergency Medical Responder credential. And for IP22, the proof of learning is the Emergency Medical Technician credential. Professional development opportunities will be available at summer conference. NCOEMS has recommended that the number of successful patient contacts increase from 10 to 30 next school year. This recommendation is currently in NCOEMS advisory. My guess is that it will pass and will impact us in January of 2027. All EMT teachers have been made aware via email, and we will discuss this at summer conference. Our teachers at NCDPI would be allowed to incorporate 15 simulated patient contacts, with the remaining 15 patient contacts required to be live patients. With the increase, NCOEMS is allowing students also to ride first response with fire departments, be in hospital emergency rooms, urgent cares, doctor's offices, and nursing homes in order to meet that 15 live patient requirement. This will increase the number of patients that your students would have by being able to go to these other locations. This will require additional MOUs between PSUs and local healthcare entities. Within the same recommendation, the North Carolina Office of EMS has recommended that there be an increase in hours for the EMT program. We will be monitoring this request. In the event there is an increase over 240 hours, we will request that the Office of EMS allow our high school programs flexibility utilizing hybrid course status. All programs are required to use the same paperwork inclusive of skills books, clinical documentation, which should be given to students prior to clinical ride time, technical scope of practice exams or TSOPs, and qualifying exams. Students must be 17 years old prior to the grade out date of the course in Continuum, which is NCOEMS's database for how they recognize our courses. And those students must have completed English 2 for IP21 and English 3 for IP22. This is in rule from NCOEMS. This error placed us under an action plan with North Carolina Office of EMS and therefore has risked all programs. Teachers also may not add students into NCOEMS's course database in Continuum, as this is a rule violation. NCOEMS will be presenting at summer conference and reviewing the items that placed us under an action plan. Programs that do not comply with rule from NCOEMS will lose their program for a minimum of 1 year. Program documents are auditable and must be retained for any student who credentials. That retention is 5 years. In the event the teacher leaves, retires, the documents must remain available for auditing purposes for any student who credentials within that 5-year time frame. IP 51, Emergency Management 1, IP 52, Emergency Management 2, the course status is standard, the proof of learning is the credential. For IP 51, that is the North Carolina Emergency Management 1 certification, and for IP 52, the North Carolina Emergency Management 2 certification. Professional development opportunities will happen at summer conference. Of note, the point of contact with North Carolina EM has changed from Samantha Royster to Sean Canoy, and that change has been made in the CVC and the CMS. IP 12, Public Safety 2, the status is standard. The proof of learning remains the credential, and that credential is the Community Emergency Response Team, the CERT credential. Professional development sessions will happen at summer conference. And of note, for NCEM, the point of contact has changed from Samantha Royster to Sean Canoy, and the CVC and CMS have been updated. IP 31, Firefighter Technology 1, the status for school year 26-27 is standard. The proof of learning is the credential being Firefighter Technology 1. Professional development opportunities will be held at summer conference. And of note, there was an addition of Objective 5.03 fire investigation into IP 31 to meet the regulation for compliance with OSFM. As we move away from Public Safety Academy approvals, enrollment summaries with information will be shared with NCOSFM to ensure each teacher that is teaching programming is qualified to teach the content being offered. This meets OSFM's requirements, and this information will be shared with them in the middle of July. In the event you have a proctor that needs training to give exams from the Office of the State Fire Marshal, OSFM, please be aware that Central Regional Specialist from NCOFSM, Joe Ramsey, will be providing indoctrination training on Monday, July 13th from 8 in the morning to 11 in Atkins 1 at Summer Conference. This session will not be recorded. Please consider sending anyone who might be utilized to proctor exams for firefighting. Pathway Professional Development Opportunities for school year 26-27. Public Service and Safety Pathway Professional Development Opportunities include a virtual session in October, Engage, Experience, and Empower, from Madison Pierce, who is the ACTE Teacher of the Year. T&I Fall Workshop will be held November 18th through the 21st in Morehead City, and other professional development opportunities that will be held virtually are listed. These opportunities will also be posted on Canvas for teachers to register for sessions. For school year 26-27, office hours will be held the second Thursday of the month from 7 to 8 a.m. and the fourth Thursday of the month from 3 to 4 p.m. Teams links for office hours will be posted in the CTE Resource Center. School year 27-28 Public Service and Safety updates. Please note that any updates for school year 27-28 are tentative and may change. For the Firefighter Technology pathway, upcoming curriculum changes will affect IP 31 Firefighter Technology 1, IP 22 Firefighter Technology 2, IP 33 Firefighter Technology 3. The North Carolina Office of the State Fire Marshal curriculum changes will go into effect in July of 2027. The North Carolina Office of the State Fire Marshal is in the process of updating standards, and therefore NCDPI will update content accordingly. Professional development will roll out at Summer Conference 2027. We have also made a request to the Office of the State Fire Marshal requesting professional development specifically for our high school teachers in the spring of 2027 for that curriculum rollout. Skills USA updates. Skills USA North Carolina information can be found on the North Carolina Skills USA website. State conference results can also be found on the website with leadership workshop, contact information for Paul and Rod with Skills USA, as well as upcoming events. The current regional rallies, state leadership conference and national leadership conference, as well as the state leadership workshop and state fair apprentice contest can be seen on the slide.